This week on Healthy Living, a look at hemophilia, a rare and serious blood disorder. And South African professor of hematology, Dr. Mahlangu, shares some insights on the condition. Plus, do people shrink as they get older? The answer coming up. Finally, a promising antiviral delivery system may be a game changer in the fight against COVID-19. These stories and more in this edition of Healthy Living. Hello, I'm Lina Khmudu. Thank you for joining us on Healthy Living. It's an inherited bleeding disorder in which the blood does not clot properly. Hemophilia can lead to spontaneous or excessive bleeding following injuries or surgeries. That's because a person's blood does not have enough blood clotting proteins, which are called factors. Experts say people with hemophilia are deficient of factor 8 or factor 9 and can bleed for longer than normal. Some may experience spontaneous bleeding into joints, muscles, or other parts of their bodies, which can lead to developmental and permanent mobility issues. Hemophilia is a rare condition globally. According to data from the World Federation of Hemophilia, over 200,000 people were diagnosed with hemophilia in 2020 worldwide. Observers say treatment for hemophilia is expensive and almost impossible in African countries. Oche reports from Dar es Salaam, Tanzania, where many hemophilia patients do not have many alternatives.
Abdulsadik Mhina has hemophilia. He's likely to suffer from excessive or severe bleeding when he has a cut or an injury. He says the condition was diagnosed very late and he suffered from permanent damage.
Sometimes you may be asleep and blood is coming out of teeth and the pillows are full of blood. I wasn't diagnosed with hemophilia and I was treated by dentists. Sometimes my hand was swollen and when I was exercising, I had to stop exercising and we didn't have factor to treat it. So as a result, the arm became paralyzed.
Edson also has hemophilia. His mother, Josephina Kibaja, says she lost her first child to this condition due to a lack of information and education about the disease.
The baby grew up with a hernia that was getting worse, and I took them to the hospital and they told us they had to have a surgery. I didn't know my child has hemophilia. About an hour after the surgery, the baby had no blood because of excessive bleeding. Then we did a blood transfusion, but there was so much swelling. After 2 or 3 days, my baby died. I did not know, and the doctors did not know what the condition was.
Hemophilia is typically caused by a hereditary lack of coagulation factor, most often factor 8. The severity of a person's condition is determined by the amount of factor in the blood. The lower the amount of the factor, the more likely it is that bleeding will occur, which can lead to serious health problems.
So hemophilia patients that have a deficiency of factor 8 is what we call hemophilia A, and that is the majority of patients, at least about 80%. 20% of the patients have a deficiency of factor 9, which is called hemophilia B. But there is also hemophilia C, and those patients have a deficiency of factor number 11.
Dr. Rwezaula says one patient a year needs an average of $100,000 for medication. The clinic provides treatment to patients, including well-known drugs and factor, as well as physical exercise. It is one of the essential services to prevent the patient from getting a permanent disability.
When this project is completed, the government or the Ministry of Health will continue to support it so that these services do not end here. We have established this so that the government can continue with the particular goal. We train specialists, mobilize and empower patients, and improve medical and diagnostic services.
Abdulsadik says he's determined to become the ambassador of hemophilia, to educate the community and advocate for better care. He's currently working with the Hemophilia Association in Tanzania.
We work to collect and send patients' data to the government. That way, they know that there is this problem and we are incorporating it into the health policy, because our treatment is very expensive.
Dr. Johnny Mahlangu is professor of hematology and head of School of Pathology of the Faculty of Health Sciences at the University of the Witwatersrand and National Health Laboratory Service in Johannesburg, South Africa. He tells us more about the challenges of tackling hemophilia in Africa and some solutions.
Hemophilia is a rare bleeding disorder in which an individual is born without the ability to form a clot. In short, hemophilia is deficiency of clotting factor, and in the case of what we call hemophilia A, is deficiency of clotting factor 8, and hemophilia B is deficiency of clotting factor 9. Hemophilia actually has a uniform prevalence globally. 1 in 5,000 live birth in the case of hemophilia A, and 1 in 25,000 live birth in the case of hemophilia B. Hemophilia is what we call an X-linked condition. What it really means is that women are carriers and men are affected. And the reason females are carriers is because they have two X's. The normal X is able to compensate for the abnormal X that to some extent protects them against having a full-blown hemophilia. The bleeding into joints will then damage the cartilage in the joint and then the bone in the joint, leading to damaged joints. Of course, if you bleed into any organ system, you are likely to have complications associated with the function of that organ. In 2020, we declared prophylaxis as the new standard of care globally. You actually prevent the bleeding from happening. The way we prevent it is to give the missing clotting factor 8 or clotting factor 9 to raise the level of the factor such that the patient does not bleed spontaneously. We can and do have now other therapies other than replacement therapy. For example, therapies that you can give subcutaneously, in other words, under the skin, that are not actually factor, but they do allow clot formation that performs the same function as factor 8. Difference is that it is given under the skin as opposed to replacement therapy, which is given reactively and into the vein. The treatment access in Africa is a particular challenge because of the poor health infrastructure. In our center, we do lots of clinical trials, and clinical trials make available the drug for free. Using that experience, we can then lobby our local health authorities who will then buy the medication. In 2022, we do not expect someone with hemophilia to have a limited lifespan.
It is often said that we shrink as we age, but is it scientifically true or false? Experts say yes, we do lose some height as we get older. According to the US-based Cleveland Clinic, losing a little height is normal with aging. Over the years, the discs between the spine's vertebrae flatten, the muscles start to lose mass, and the spaces between the joints narrow. Men can gradually lose an inch between the ages of 30 and 70, and women can lose about 2 inches. However, a significant loss of height as we get older can be a sign of a much bigger problem, like osteoporosis, a disease that weakens the bones and can cause sudden and unexpected fractures. Experts say eating foods rich in calcium and vitamin D, such as dairy, fruits and vegetables, and exercising regularly, managing your weight, and maintaining a good posture can help slow down the loss of height as we age. As people learn to live with COVID-19, what do you see as one of the most important health concerns in your community presently, and what do you think should be done?
The major health concern in my community right now is malaria. It kills faster than every other thing. It's just that so many people, they don't know about that.
Lack of electricity, that people might suffering of it at the cost of it. The major thing, I think, the malaria, the typhoid, and the diarrhea.
Psychologically, I find that a lot of people are suffering today for sickness due to the poverty level in the country.
Mostly malaria, because the environment is so filthy, so dirty, that mosquitoes everywhere.
What should be done is at least a proper fumigation all the time, so that the area will be free from mosquito, and the provision of water.
Health facilitators should move around to see what they can do, either to educate people on how to live on, check mostly the FCT minister on the hygiene. I mean, there should be something they can dump their refuse so that they shouldn't just dispose it anyhow.
I take fumigation, environmental people have to take care of the environment to make sure that the environment is clean and for us to live a healthy life.
Southern Malawi has started recording cases of cholera. Health authorities in the country say the disease is largely a result of floods caused by Tropical Storm Anna and Cyclone Gombe, which hit Malawi in the past 2 months. Over 30 people have been infected and at least 2 people have died. Malawi Ministry of Health says it is distributing chlorine to communities in affected areas for water treatment, as well as sending cholera control information to all the people through various channels of communication. Cholera is an acute diarrheal infection caused by ingesting food or water contaminated with bacteria. The disease affects both children and adults if untreated, and it can kill within hours. Cholera is more common during the rainy season. A promising antiviral delivery system developed at Northwestern University in Illinois could be a game changer in preventing and treating COVID-19 infections. VOA's Kane Farabaugh has more.
For several decades, Kelly Callahan has worked for the global nonprofit Carter Center to provide treatment and medicine to people suffering from neglected tropical diseases in some of the most remote and warmest places on the planet.
You have to go far beyond the end of the road to deliver these vaccines or these drugs. Maintaining a cold chain becomes incredibly difficult.
Callahan says complicated logistics to keep the medicines cold aren't the only obstacle. Antibody therapies are difficult to develop, expensive, and often must be administered by medical staff. Many patients also don't want to be injected with needles.
Anything that can be done to reduce the challenges in delivery will make delivery much easier.
Which is exactly what Northwestern University's Dr. Michael Jewett is trying to do. Dr. Jewett and his staff at Northwestern's Center for Synthetic Biology, in partnership with the University of Washington and Washington University in St. Louis, first used supercomputers to design a new protein-based antibody nasal spray. It was refined in testing on mice and delivered promising results in combating COVID-19.
It's actually effective at neutralizing all of the variants of concern in this mouse model.
Testing showed Northwestern's nasal spray outperformed current antibody treatments. Northwestern's nasal spray maintained effectiveness for longer and also reduced the overall level of infection.
One of the special features about this antiviral therapy is that we can both treat and prevent it.
The next crucial step for the research team's nasal spray, which is cheaper to manufacture, doesn't require cold storage, and can be self-administered, is determining its effectiveness in humans.
We've currently partnered with a biomanufacturing company to scale up the synthesis for testing and ultimately moving this towards phase 1 clinical trials. All of the elements of the platform that we've been able to put in place could be repurposed towards future viruses.
Clinical trials for the COVID-19 nasal spray could begin by the end of the year.
For more health news and medical breakthroughs, stay connected to Voice of America at voanews.com. You can follow me on Twitter at Linochmudu. That's our show for today. Until next time, stay well and strive to make every day a healthy day.